not a long agenda, and our presentations with Q&A. I'm first Lopa, our Impact Director at Family for Every Child, will welcome and introduce and launch the community of practice. After which I'm going to give a little introduction about what community of practice is and what is mental health, or the way we understand mental health at Family for Every Child. And then the highlight for today will be presentation from ABTH, one of the member organizations of Family for Every Child in Brazil. Today we have Beatrice and Mafe talking about their therapeutic and mental health work in their communities. And then we will have a little time, probably 10-15 minutes or even more maybe if we finish early, for Q&A. This is only, we are taking this opportunity to invite our member ABTH to talk about their practice. But otherwise, the purpose of this community of practice is to encourage all of us to participate in this community. We will have more such options to listen to the others and probably even some of you. So I invite Lopa Bhattacharjee, our Impact Director, to talk about Family for Every Child. Welcome, Lopa.
Thank you, William. Once again, a very warm welcome to today's event. As William mentioned, I'm Lopa Bhattacharjee. I'm the Director of Impact at Family for Every Child, and I'm today joining from India. At the very start, I'm very happy to announce the official launch of the Community of Practice on mental health and well-being today. And thank you so much for joining in this launch event. And I know and I appreciate that you are all joining from different parts of the world at different time zones. So thank you again. Thank you. Really appreciate. Before we move on with today's event, I wanted to give a brief introduction. Family for Every Child is a global alliance of 57 members across 42 countries, in addition to having 8,000 plus community of practitioners, which is facilitated through our digital platform, Changemakers for Children. We are a child rights focused alliance, collectively working towards improving positive outcomes for children and families. Our methodology involves building evidence that is rooted in local practices and approaches that we do through knowledge sharing, development of knowledge and documentation, as well as research, which is locally led by the CSOs. We then use this evidence to disseminate and influence policy and practice through advocacy and campaigning. With our current strategy, we focus on strengthening families and building their resilience, where children can grow and thrive and can be prevented from any adversity. As an alliance of local CSOs and practitioners, we are committed to build knowledge rooted in local solutions and approaches. We are committed to integrating mental health and well-being as a core to develop and deliver our impact strategic priorities. Through this newly launched community of practice, we look forward to everyone engaging in collaborative learning. The community being an open and accessible digital platform, community members will be able to co-design, co-lead, and co-develop knowledge and evidence across diverse contexts of mental health and well-being practices to support children and families. I therefore welcome again and urge everyone as individuals and organizations to please sign up to this community if you haven't yet, and own up the space in taking forward a vibrant movement of practitioners focusing on mental health and well-being of children and families. I now hand back the floor to William to take you through the rest of this launch event. Thank you so much. Back to you, William.
Thank you, Lopa, and thank you for launching our community of practice officially. I just want to have 3 or 4 slides to further explain what community of practice is for us and mental health, since it's going to be the focus. Community of practice is a group of practitioners who come together to learn from each other and strengthen their work towards a common purpose. So it brings together people working on a common theme or challenge. So this is also a space for ongoing interaction and exchange, a focus on real world practice and experience. We are hearing towards practice and exchange. So this is not today's like one-off webinar, but a top-down training or a passive information space. So the community of practice is going to be a peer learning space grounded in what works. I think that's the focus. And it will be focused on improving practice together. So it is peer learning and not training. So what we will do together in this community of practice, we share practical experience and challenges, learn from diverse contexts and approaches, or we exchange tools, ideas, and examples. We reflect on what works in practice, build connections across members, across organizations and individuals over time. This can lead to practical insight and guidance. So it's a stronger approaches across contexts, shared learning that can inform wider work. I put it here, turning experience into insight. How we'll work together to make this valuable for everyone. So we will meet regularly with a clear focus. It could be through webinars, it could be other forms, even just posting things and people commenting and sharing, discussing. We also create a space that is open, respectful, and inclusive. We are going to prioritize a little more on family for every child, already prioritized themes through this. That is children on the move, prevention of sexual violence, and kinship care. So through these priority themes, how mental health, or rather how we see mental health through these priority themes. Now, a little bit about mental health and why we are prioritizing mental health at Family for Every Child. From our scanning and from our experiences, we understand children today face growing pressures, conflict, climate, poverty, violence, to mention a few. And these affect not just safety, but the emotional well-being of children and families. So stress and trauma can lead to the challenging issues that the sector is trying to address, family separation and the long-term harm. So from that perspective, mental health is not optional. So we are considering it's essential in protecting children and families. So what this means for our work and how we respond as Family for Every Child, we are supporting strong, resilient families. And to do that, integrating mental health into all our work. And as I mentioned earlier, when we say all our work, primarily focusing on the real needs of the children on the move, those in kinship care, and prevention of sexual violence. As a recurring context focus that we keep in mind is that we are going to strengthen local and culturally relevant solutions and not necessarily already pre-existing psychological theories. And I also want to stress not necessarily a clinical approach, but what is a human approach that is already existing and that we are using in our communities. So strong families need strong mental health. And when we support mental health, we prevent separation, support healing, and help children to thrive. Now, after this webinar, the community will be officially open to you and your organization, to your other networks, friends, and to join the group. I will put this slide and link also in the chat. So you can click this and join the community. From now onwards, it will be open. So we thought, aptly, as I mentioned, that our focus is to look at culturally and context-based approaches in understanding mental health and promoting the well-being. So we thought we start with one of our members, Family for Every Child members, to talk about their experiences and how they have contextualized, make it meaningful for the children and families that they are working. We are going to listen to them more, but I just want to also introduce the two speakers. We have Beatriz Matos. Beatriz is a communication specialist and journalist working in social project coordination and institutional communication. Beatriz facilitates learning with adolescents using communication to strengthen relationships, promote rights, and encourage youth expression. Her work is grounded in active listening and a strong belief in communication as a tool for social change. And we have Mafe, who is a writer, educator, and facilitator at ABTH. She supports children and adolescents through educational activities and individual care, while also engaging in the cultural sense as a poet, in the cultural scene as a poet and a producer, celebrating Afro-Brazilian culture through her work. Thank you, Beatrice and Mafe, for joining us today to share your experiences. And now the floor is open to you. You're very welcome.
Olá a todos, é um prazer estar aqui com vocês, compartilhar um pouco da nossa experiência. Hoje a gente vai falar sobre o projeto que a gente tem, que é o Vozes da Alma. É um projeto de práticas narrativas para a gente ressignificar várias questões, né, com os adolescentes aqui dentro do território, né, que a gente atua. E aí, antes de qualquer coisa, eu queria começar essa apresentação com uma, uma pergunta para vocês, né? Quem fala sobre saúde mental na favela? É muito difícil a gente encontrar pessoas que falem sobre saúde mental em favelas, em comunidades, né, pequenas. A gente tem tabus muito grandes relacionados à saúde mental. E justamente por essa questão e por analisar a necessidade desses adolescentes aqui do território, a gente, a gente começou, né, a conversar sobre saúde mental. E quem somos nós, né? Nós somos a Terra dos Homens. É uma associação criada em 1996 para promover e garantir os direitos de crianças e adolescentes. E trabalhar também a convivência familiar e comunitária desses adolescentes. Então a gente não trabalha também só o adolescente, a gente trabalha essa família junto, porque a gente acredita que a família ela se transforma num conjunto. Então a gente trabalha a família como um todo para que a gente tenha uma mudança comunitária mais fortalecida, né? E aí, para isso, a gente trabalha em três eixos de atuação aqui na Terra dos Homens. O primeiro eixo é o atendimento direto, que a gente faz esse trabalho, né, dentro do território, com as famílias, com as crianças, com os adolescentes. O segundo eixo é a disseminação de conhecimento. Então, a gente dissemina essa bagagem que a gente tem dentro do eixo um, a gente compartilha com outras organizações. E a gente tem o eixo 3, né, que é a defesa de direitos, o advocacy, que a gente leva isso, né, para outros lugares através, né, de políticas públicas para que outras pessoas, outros territórios também sejam, aproveitem a nossa experiência para que tenha transformação no mundo como um todo e não só no território que a gente atua. A gente compartilha muito essas nossas experiências para que a gente tenha essa mudança de, de vida, né, dessas crianças e adolescentes em todo o mundo. E hoje, especificamente, a gente vai falar desse eixo um, que é o eixo que a gente está aqui hoje atuando, que é o Centro Comunitário, onde a gente desenvolve o projeto Vozes da Alma. O projeto Vozes da Alma ele é desenvolvido dentro do Centro Comunitário Terra dos Homens, que ele fica localizado no Complexo da Mangueirinha. O Complexo da Mangueirinha, ela é uma comunidade, é uma favela, né, aqui do Rio de Janeiro, com alto índice de violência, e não só alto índice de violência, a gente tem diversas questões relacionadas a a limitação, né, de acesso dessas famílias aqui. A gente tem questões relacionadas também a acesso à cultura, acesso à educação, acesso à saúde em si. Então, a gente trabalha nessa comunidade aqui no Complexo da Mangueirinha, a gente quebrando, né, esses paradigmas que essas famílias e essas crianças e adolescentes têm. E a gente está aqui atuando no Complexo da Mangueirinha desde 2008. Então, durante todo esse tempo, né, de trabalho aqui no Complexo da Mangueirinha, a gente viu o contexto social aqui. A gente tem um contexto social de desigualdade, né, social, racismo, exclusão. Então, o que a gente identificou é que, apesar de todas essas questões que muitas vezes são noticiadas, né, nos jornais, na grande mídia, a gente viu que com todas essas mazelas, né, que a gente tem dentro do Complexo da Mangueirinha, a gente vê uma comunidade forte, uma comunidade potente, uma comunidade resistente. E o que a gente quer fazer, né, que a gente fez, né, através desse projeto, é justamente mostrar para essa comunidade essa força que ela tem. Que a gente não fique revivendo tudo que a grande mídia faz, mas que eles entendam dentro deles a potência que eles têm. Então, diante de todas essas questões, né, dessas limitações que eles têm, a gente traz informação que a gente viu que muitos têm essa barreira, né, do acesso à informação como um todo. Por mais que a gente esteja num mundo que tem internet, só que as informações que chegam para essas pessoas são muitas vezes as informações que reforçam é, a visão negativa que tem essa favela. E muitas vezes as pessoas, por ouvir tanto o negativo, elas acabam absorvendo isso para elas e entendendo que elas são aquilo ali. E o que a gente fez com esse projeto é mostrar para eles como se fosse mesmo um espelho e mostrar, olha quem vocês são, olha a potência que vocês têm. Então, o que a gente fez foi mostrar, mesmo através desse projeto, a potência, né, que tem. E como que começou esse projeto, né? Como que surgiu o Vozes da Alma? Como eu falei, a gente trabalha aqui no Complexo da Mangueirinha desde 2008. E durante esse processo a gente sempre trabalhou com essas crianças e adolescentes em famílias a questão da violência física. Só que a gente percebeu que a gente conseguiu ter a redução da violência física, mas a gente tinha uma questão, um tabu muito forte da questão da violência psicológica. E no pós-pandemia, né, com a questão dos impactos, né, do Covid-19, que teve o isolamento, as instabilidades, né, por morar em favelas, os espaços são menores, a convivência teve que ser, a família teve que ter uma convivência muito maior, todo mundo no mesmo espaço, sem divisão de quartos, e isso a gente viu que afetou muito mais a saúde mental dessas crianças, desses adolescentes e das famílias também. E o que a gente percebeu é que eles não tinham tanto espaço para se expressar emocionalmente, nem falar o que eles estavam sentindo. Então, a gente ouviu, né, esses adolescentes, a gente trabalhou com as escolas aqui locais e através dessa parceria que a gente tem com as escolas locais, a gente conseguiu criar, né, essas estratégias para trabalhar a saúde mental através da arte e da cultura, porque a gente tem um tabu muito grande, né, para falar sobre saúde mental. E através da arte e da cultura a gente conseguiu com que eles ouvissem sobre saúde mental sem, primeiramente, falar sobre saúde mental. Eles entenderam na prática o que é o cuidado com a saúde mental. E agora eu vou passar para a Mafê, que ela vai explicar para vocês como que a gente desenvolveu esse projeto. Eu falei muito mais na parte teórica, né? E a Mafê vai mostrar a prática, como que foi, como que a gente conseguiu fazer essa mudança na vida desses adolescentes através de todo esse nosso trabalho aqui por trás.
Good morning. My name is Mafe. I would like to present myself before starting to present the project. So basically, I'm 24 years old. I'm an autistic.
We are not hearing Mafe or the interpretation. Are you speaking in English?
Yeah.
Yes.
Okay. Okay. Thank you. Okay, continue, please.
So I'm an autistic and I'm a person and I'm working with teens actually doing arts and also. So what is a project? Basically, it's a mental health project that we work with by art. Esquisito de falar. Okay, so I'm sorry I'm nervous, but I hope I can make myself clear.
Now it's better. Yeah. Please go ahead.
Mhm.
Continue, Mafe.
Okay. Okay, so basically what happened is that's it. We started working with them, talking about art and poetry slam. I'm a slammer and I do write and all stuff. So we started using what they know about art. That is like funk, that is like the spray painting on the walls that they do know about, that they see outside their houses and all stuff. And basically, we wanted them to be able to talk to themselves, like not themselves, like only classmates, but like teachers and the people who work at the school because they don't know how to communicate. Normally, here, teens and kids, they're not heard at all. So basically, people do not accept whatever they talk about. So we started, that's it, working with them, making them feel comfortable to speak and to explain themselves. and then we could see how they would be feeling, how they would feel after expressing themselves on like, oh, I want to drink water, and they don't say that. So they started saying, oh, I'm thirsty, and now I can drink water. Can I go? And that's like how we started. So we worked with a couple pilots, but most of them 3 workshops where we would teach them painting, poetry slam, communication, and audiovisual. And we would start our spaces with circles, and we would talk about what color do we feel that we are today, and why do we like the color green and yellow, and things that they like, or why do they think that the song that they heard at school is good? And why do they think that the song that their parents hear at home are not good enough? And we would like start with small conversations so we can learn about them and they could learn about themselves too. So, yeah. It's easier to do the work than explain it. I have to say it. But like, yes. So why we decided to do that? We learned that most of the teenagers here, they do have low self-esteem. They do suffer from physical violence. They do not are comfortable and they are not used to speak about what happens to them. They are seen as bad people by the whole society. Society does not see people who live in favelas as people as good as the people who do not live there. They do think that all of them they have stigmas, and people don't hear teenagers. And what we did was the opposite. We gave them a special place where they could sit, talk about themselves, talk about how hard it is to be a teenager nowadays. How do they want to talk about the weather and people do not listen? How do they want to talk about the rain and the water covered their whole house and they wanted to talk about it, but people will not listen and they lost everything and people will not listen. So we gave them that space and we did that with simple chores, with simple things that we do. And that's it. We understood that basically we have a space at school that do not understand them as human beings. So that's it. That's the main thing. They didn't know that they could speak. I think that I've been talking about this whole time, but they didn't see themselves as individuals. They couldn't see themselves as a group. They couldn't see themselves as persons who could do something in the society. So we started with simple tasks as like, oh, can you ask your friend how do they feel today? And can you write it down in a notebook and tell us know what did you understood about it? And they were like, oh, we can do that. And they started doing this. And they would be so happy coming back at class and like, oh, my friend is good today, and my friend is not very good, but I said something good to him. And they were like happy to do this stuff. So we started doing these simple tasks and we did like, oh, can you ask someone in the neighborhood how do they feel about the weather? And they started doing these little interviews with people outside and they started telling their stories during telling their stories. But yeah, and with all this work we've been doing during this time, they decided they wanted to do a documentary. They decided that they wanted to talk about the stories that people do not see from favela. They wanted to talk about personalities from the place where they live that make the difference in their eyes. So they interviewed like 5 eixos de entrevista. Foi? 5, like, want to talk about it. Okay, so B is gonna talk a little more about the documentary, but like they decided to talk about this, and during this whole time, I can say that they produced a music. They wrote a song with me in the classroom. decided to do a theater thing. They did it. And they decided that they would learn how to rhyme. And they decided that they wanted to write poetries to say about how do they feel, all because we gave them space so they could hear. They could speak and they could hear each other. So, B is gonna talk about the documentary a little bit.
Então, a partir de tudo isso, né, que a Mafê explicou, para vocês, a gente fez uma roda de conversa, né, com esses adolescentes, e esses adolescentes eles contaram as próprias histórias. E a partir dessas histórias que eles se ouviram nessa roda de conversa, eles viram que as histórias conversavam. E aí, a partir disso, eles selecionaram 15 personalidades aqui no Complexo da Mangueirinha para fazer um documentário sobre a vida dessas pessoas. E o intuito deles não era mostrar as mazelas dessas pessoas, e sim mostrar a potência que eles têm, como que eles ressignificaram a vida deles através da arte e da cultura. E como a Mafê disse, a gente separou, né, esse documentário em 5 eixos principais. A gente trabalhou com eles arte e cultura, a gente trabalhou com eles educação, empreendedorismo, esporte e esporte e o projeto em si, né? Que eles falaram a própria experiência deles através do projeto. E todos esses eixos de atuação foram pessoas que são personalidades do Complexo da Mangueirinha. E aí eles escolheram essas pessoas para valorizar quem está dentro. Eles expressaram bastante a vontade deles de falar. Geralmente a gente expressa muito, valoriza quem tá fora, né? Os artistas que aparecem nas grandes mídias, nas TVs, na internet. E eles queriam valorizar quem tá dentro. Desculpa. Eles queriam valorizar quem eles veem todos os dias. E queriam mostrar como que todos esses eixos de atuação, dentro desses eixos, eles conseguiram ressignificar a vida deles e transformar não só a própria vida, mas a vida de quem está ao entorno deles. E o que a gente quis mostrar com esse documentário é a potência dessas pessoas que são separadas nesses eixos de atuação, mas também a potência desses adolescentes. Porque para fazer esse documentário, como vocês estão vendo aqui nas fotos, eles aprenderam sobre enquadramento, sobre luz, sobre todos os bastidores, né, por trás de uma gravação, mas também entrevista, né? Todas as perguntas que foram feitas nesse documentário foram feitas pelos adolescentes. A gente fez a roda de conversa e tudo que tá nesse documentário foi feito por eles, né, e para eles. Então, a gente viu uma potência muito grande de comunicação nesses adolescentes. A gente viu como que a comunicação e como que a arte e a cultura elas conseguem eles conseguem se expressar de uma forma muito melhor, porque a gente viu que anteriormente eles chegaram muito calados, muito silenciados, muito abafados por todas as questões que eles enfrentam, e aqui eles conseguiram florescer. Eles conseguiram mostrar toda essa potência que já estava dentro deles e eles não conseguiam colocar para fora por não saber como fazer isso. E como a Mafê disse, né, a gente trabalhou essa questão da arte e da cultura para depois a gente falar sobre saúde mental. Porque quando a gente chega falando saúde mental, a gente tem uma resistência muito grande para falar sobre isso. E quando a gente traz a arte, a cultura, a vivência deles, a experiência que eles já têm, falando subentendido, né, sobre saúde mental, a gente consegue com que eles se desenvolvam melhor e com que eles se sintam muito mais em casa, né? Eles se sintam esqueci. Pertencentes, exatamente. Pertencentes a esse local. Então, a questão do documentário foi justamente essa, a gente fortalecer eles para eles.
And when we talk about, that's the thing. When we talk about mental health, most of them don't know what mental health is. But when we talk about how they feel, they do know what they feel. They don't know the name of, but they know what happens inside of them. So we started doing it. We started talking about what happens inside of them, and then we gave the name of it. And it's something that really happened. So yeah, with this, they learned how mental health needs to be accessible and how the language of it does not need to be like very, 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 like it's they learned how listening it's important, and they learned how to listen each other, and they learned that listening they could do more, and they showed to their parents, they showed to the society that youth is not a problem, actually is the solution, because most of them are people see them as that's the base. We work with kids that society says they're not very well behaved. They're not kids who are the good examples, the A kids, you know? They're like the kids who do the best in the living room. They're like at the classes. They're the kids who talk a lot. They're the kids who people don't see doing stuff. And when we showed that they just needed to be heard, that they just needed to be worked with a little bit, that they could, show their potentials in a healthier way. They did it, and we showed society and especially schools that we were working with that they were good kids. They were nice. They're good. And we worked with data too. So we have a percentual of what we did. So we had 80 teenagers involved. And we had 20 teenagers who really did every day. We had 75% of kids who were here all the time. We had 82% of leadership of them. We had 90% of self-care. But like beyond the numbers, we had kids.
I think we lost you.
Started speaking up. We had kids who started doing things for themselves and talk about what they wanted. We were invited to international film festival in Pedras do Espírito Santo here in Brazil, so we could show their movie to people. So I went there, and they basically we showed them what they did, and people really understood and saw what they were trying to say. For the first time in a long time, they were heard about society. So, yes. And now we don't need to talk about mental health a lot. They do know about mental health. They do know about what is and how to take care of it. And even though we have some cases that we need to be looking up with a little more attention, we do work with psychologists here in the community center. We ask her to talk to them when it's something that we as teachers we cannot profound too much. They have the support from psychologists. They have the support from our team. They're amazing. So basically, we showed all of their products, everything that they did, like the music, the TV show, the theater. We showed it in schools, theaters, museums, festivals. We did it. So more than 600 people saw what they did, and they started talking about internet protection for the kids. So now you can see a little bit about my kids. These are they're like very nice. They're a lot, but they're cute kids. And that's the two places where we did all these things. So the first one, we gave them certificates. We called their families, and they were there to see, and they were so proud of them. For the first time, we had parents saying, "Oh, now I can see that that my son is doing something that it's good for them. Now I can see that my daughter is like really working on that she's doing something good, that she's special in some way. And that's something that for us we could see them from the beginning, but for their parents to recognize this on them, it was like amazing for us. And then we have the second time, we did it a couple times. So yeah, we do have, these are two of my babies who decided that they wanted to say something about who they are and what did they do. So it's really fast, I promise, but it is. And this is my other. I'm sorry, guys.
If the audio is not audible, you may have to say a word about it, what they're saying.
And they do recognize now that they're feeling better with themselves, and that's the most grateful thing. So they do say that, so we say that when a teenage speak, they become stronger, and when many of them speak together, they transform the whole territory. And we do have their documentary on YouTube. Everyone who wants to see, who wants to understand, who wants to listen their song, that it's in the end of the documentary, you're able to. We made it, and I think that's it. Thank you so much for the opportunity. Thank you so much for everything, guys. And yes.
Thank you, Morphe and Beatrice. Fantastic, amazing job you're doing. Maybe if you have a link to that video, you can put in the chat. People can. But thank you, wonderful. It was so pleasant and nice to hear these wonderful stories. Thank you. We are going to just invite people if they have any questions. But before that, I just wanted to say that what you're trying to tell us is that you didn't go with the hat of a mental health professional, or so you just engaged with children and adolescents using music, documentary, education, sports skills, and just make them feel belonging. And you spoke about listening so many times. I think if you can just do that one thing, listening, that is actually supporting young people with emotional well-being. And mental health, of course, it's a spectrum. It's not like, you're right. It's not that you're dealing with their mental health issues and we don't need to tell them. I think at the moment, globally, we are talking more about emotional well-being. In fact, we are not even using that mental health. I think after COVID, it became a little more popular. That's why they use mental health and psychosocial support together. And another thing you mentioned about the young people, the adolescents, talking about their bad behavior, don't see just the behavior. I think at the moment, when you look at trauma-informed care, the basic thing is that it is not that what the behavior is, but we are asking why that behavior, what is behind, what is the pain or anger or sadness, whatever behind that negative behavior. So I think this is such a fantastic human approach that you're using. And I like the lessons that you spoke about. Um, uh, that youth is not a problem, they are the answer. One of the lessons I think that you learn, the young people, adolescents and youth, we don't look at them as problems, but they're solutions and answers. Thank you for this wonderful presentation, and even the name of your program, Voices of the Soul. So just one word for me is what resonates with Family for Every Child talking about is resilience. At the end of the day, that when you talk about who they are and what their strengths are, what you're doing is you're building their resilience. So I think that's a good lesson that we all take, and these are the ways that you build resilience, not just through counseling and therapy, but engaging them in arts and things that they like. You very clearly mentioned that what they wanted to do. Yeah, thank you. This is fantastic. So, from the participants, if you have any questions to Beatrice and Mafe, you're welcome. You can put in the chat or you can ask. We have another 11, 12 minutes. There were a lot of stars and thumbs up. So that looks like they all enjoyed your presentation. If Yeah, think about if you have any question, you can unmute yourself and you can ask question. I think the people will be able to. Okay, there's a question here. How did you guys ensure that the space was a safe space for them to open up? So,
Então, antes de qualquer diálogo, né, com esses adolescentes, a gente trabalha as relações, né, que a gente tem com eles. E dentro desse projeto, desse trabalho, né, das relações, a gente cria é, o- é, são regras de convivência, um acordo
Um
de
acordo.
convivência. É um acordo de convivência. E dentro desse acordo de convivência, a gente coloca, eles falam quais são os pontos que eles acham importante ter dentro dessa roda de conversa. Então, muitos deles falam que o que foi dito aqui fica aqui, é, questões de respeito mútuo entre os adolescentes. Então, eles vão criando esses acordos de convivência, e dentro desses acordos, eles mesmos se impõem. Então, o grupo é deles. A gente, como a gente já disse, né, a gente não chega com nada exatamente pronto. A gente tem um cronograma de atividade. Mas quando a gente passa essa atividade para ele, ela é construída muito em conjunto com esses adolescentes. Porque a gente entende que quando a gente constrói a atividade em conjunto, a gente tem um resultado muito melhor, porque eles estão envolvidos, eles estão engajados com essa causa. Então, foi criado por eles. Então, eles se sentem pertencentes. Então, quando a gente faz uma atividade em conjunto, a gente tem um resultado muito maior. Em contrapartida também, o que faz desse ambiente, né? Um ambiente que eles se sintam seguros para falar, é porque a gente trabalha muito a questão do psicossocial. Então, quando a gente tem rodas de conversas com a nossa psicóloga aqui do Centro Comunitário Terra dos Homens, então eles se sentem abraçados, envolvidos, e quando necessário também tem atendimento direto com essa psicóloga também para esses adolescentes. Então, todas essas etapas, né, que a gente segue do projeto faz com que eles se sintam seguros. Então, para que tenha, né, um espaço seguro, e além dos anos que a gente já trabalha aqui também no território, e a gente todas as mudanças que a gente já contribuiu aqui para o território.
thank you, Beatrice. So we have another question. We know that in Brazil, the community aspect has a significant impact. You got the question? So they're saying that in Brazil, the community aspect has a significant impact. Could you share your community-based approach to mental health? Maybe rather, how did you also engage? maybe how did the community see all that you're doing, and when you say community, families and people in the community, what was their response, or did they have anything to do, or how did you engage them? I think at one point you spoke about adolescents talking about we don't want them to tell us our behavior is bad, but you want us to see as people. So anything about community involvement, engagement? I think that's a good question.
Quer começar contando?
Então, o que a gente viu, né? Esses adolescentes, como a gente trouxe, eles eram vistos na escola como os complicados, né? E o que a gente viu através desse documentário, através de todo o trabalho que a gente fez aqui comunitário, é que eles viram a potência desses adolescentes. A gente teve vários relatos da comunidade mesmo escolar que esses adolescentes melhoraram o comportamento deles dentro da escola e a gente teve esse relato que melhoraram com os pais. E o que a gente viu como um todo, né, nesse espaço comunitário é que esses adolescentes, a comunidade se mudou a perspectiva delas em relação aos adolescentes, porque o que eles tinham que eles não poderiam criar nada. E eles criaram um documentário potente e que tem uma linguagem que, quando vocês forem ver, eu aconselho que vocês assistam, porque é incrível você ver a mudança dessa perspectiva desses adolescentes do início para o final. E ver a mudança que eles tiveram de comportamento e de informação comunitária. E aí também é uma coisa que a gente esqueceu de falar na apresentação, mas uma coisa que é muito importante. Aqui no Complexo da Mangueirinha, muitas pessoas elas não têm, não sabem ler e não sabem escrever. A escolaridade é baixa. E a gente viu que através do documentário, através de imagem e som, a gente conseguiu atingir muito mais pessoas. Então, essas pessoas elas conseguiram ouvir e compreender essas questões de saúde mental. Então, é importante também, foi importante para a gente que a gente analisasse o território como um todo, a gente visse o que funcionaria melhor. E isso também veio de entendimento dos próprios adolescentes e que a gente criou, que a gente viu na comunidade como um todo foi essa mudança de pensamento desses adolescentes, em relação, né, aos adolescentes.
Um, so basically, I
Thank you,
wanted to.
Beatrice. There was a question about if you had any challenges, and I think the person clarified not necessarily hurdles, but any challenges that you faced um, as part of this work.
That's it. We are working in a favela, like it's a complex with 5 favelas around. Like a complex is a place where you have more than one favela. So Complexo da Mangueirinha, it means that we do have 5 favelas near to each other. So most of the time, our meetings with the kids could not happen like here because we would have operations from the police. We could not, it was not a safe space, so they could come here and we could do the things. So we needed to deal with all this stuff. We needed to give them online support. We needed to do like video calls so we could check on each other because it was not easy. And it's always a tense moment. It's always a moment where not necessarily we feel comfortable as a person who also lives in a community, but we try to make a support thing, a support community place. And one of these things is that like they learned how they could support each other on this whole moment.
Thank you. There was
E
one last
uma
question.
outra
Yeah, go
pergunta
ahead.
que eu vi aqui que eu acho que é interessante para a gente responder é sobre o monitoramento e avaliação, né? E como que a gente mediu nesses impactos do projeto? Aqui no projeto, qualquer projeto que a gente faça aqui na Terra dos Homens, a gente tem um marco inicial que é um questionário que esses adolescentes respondem. E a gente tem um marco, né, de processo, que é no meio do projeto a gente faz de novo e a gente tem o marco final. Então, a gente avalia esses adolescentes através desse questionário em três momentos, né? E esses momentos eles são registrados em um documento que a gente chama de diagnóstico. Então, a gente tem um diagnóstico pronto desses adolescentes no início, meio e fim. E aí, e além, né, desse questionário que a gente aplica nesses adolescentes, a gente também tem um diário de campo, né? Que cada monitor, a gente tem hoje a Mafê e a Carla e a Conceição, que são monitores fixas, né, do projeto. Eu fico mais flutuante porque eu estou na coordenação do centro comunitário como um todo. E eles fazem uma análise do diário de campo delas em relação a cada adolescente. E a gente tem também reuniões, né, de equipe que a gente discute esses casos e a gente analisa cada caso de uma maneira individualizada para que a gente tenha um resultado potente no final. Além também de a gente tem essa reunião da gente de equipe, a gente tem uma reunião com eles também, que a gente passa para eles também o que que a gente está sentindo para ouvir deles também falas, além do questionário, que a gente viu que às vezes o questionário ele gera um pouco de dúvida em algumas adolescentes que têm mais dificuldade de compreensão, e a gente conversando, a gente falando. O projeto é muito baseado nessa questão da escuta também, né? Então a gente escuta bastante os adolescentes para contribuir no monitoramento e avaliação desse projeto. Então, eles estão constantemente, a gente está constantemente ouvindo esses adolescentes para que a gente faça o projeto que o projeto seja o melhor para eles.
Thank you, Beatrice. I think we are also come to the end of the call. Really, thank you so much. And Mafe, since you composed some music, do you want to sing a small tune to close? And for those of you who have more questions, this is a good opportunity for you to go to the Changemakers and then you post your questions on the community of practice. Your questions will be the first questions on the community. I have put a link there. So those of you who have more questions or if you want to ask anything more to Beatrice and Mafe, or please go to the Changemakers, open the community of practice, and you can continue the discussion there. Mafe, you have a tune or?
I'm gonna do the song that we wrote together, me and the kids. Can it
Yes,
be?
please. Yeah.
Okay. So I'm gonna sing in Portuguese, but if you watch the documentary, you're gonna see the legend, okay? So it's like this. Cheiro de pneu queimado, carburador furado, crianças correndo por todo lado, os menores sendo queimado, mãe chorar do nosso lado, realidade dos pedaços. Subir na favela, os menores jogando bola, trocação de tira-blaze na porta da escola, mãe desesperado indo atrás do seu filho. Saiu no portão, atividade tá caído. Ei, menor, corre ou vira pó. Ei, menor, corre ou vira pó. Just a little bit, just a little bit.
Thank you. Thank you. Thank you all for joining us today, and especially to Beatrice and Mafe. Thank you. So we'll see you on the Changemakers platform. Okay. Bye. Thank you, interpreters, and thank you all the participants who joined us today. Bye.